Mr. Smith. Good morning, Mr. Smith. It's nice to see you here. I'm Dr. Linda Chua, and I want to learn about your current health. What brings you here today?
I'm having stomach pain.
Can you describe the pain for me?
I have this pain every time I eat, and it lasts for a couple of hours.
Okay. Have you ever had any changes in your diet?
No, but sometimes I skip my breakfast, and when I eat my lunch, suddenly my stomach goes really bad.
So your stomach pain gets worse after a meal and even as you skip a meal. On a scale of 0 to 10, 0 means no pain and 10 means the worst pain you've ever had. How would you rate the pain?
8, and I don't think I can take this any longer.
I understand. You know, sometimes stress makes your pain worse. Is there anything going on in your life today, right now?
Well, I lost my job and I live alone. And my daughter has been diagnosed with cancer. And right now I'm doing my best to take care of her and her children's.
I know you have a lot of worries right now. I can see that it's been really difficult for you to handle all of this. But I admire your strength in dealing with your life. We're going to figure out what makes you pain, and we're gonna make you feel more comfortable.
Hi Deepika, how are you doing today?
Yeah, I'm fine. How are you?
Okay, fine. How is your breathing right now?
Yeah, it's better than yesterday actually.
Okay. Any pain at anywhere?
Pain? No, it's not like that. Everything good.
Would you mind if I listen to your lungs?
Yeah, sure. Check.
Alright, take a deep breath for me. One more time.
Okay, good.
Everything is alright? Yeah, everything is alright.
And our goal is to give her the pain medication so that she would feel comfortable. Then we saw that we get her out of the bed, then we let her sit on the edge of the bed so that to prevent her from getting dizzy from the medication. Then we make her stand for a minute to make sure that she's okay. She's on a blood thinner to prevent blood clots and to keep her blood from circulating. These are going to be important to continue once you're at home. It is essential that her home medications to be taken.
Yeah, okay, but I'm not really sure that my wife and I could recall the time and the dosage of medication. Will you be provided with a copy of instructions before we get discharged?
My husband is right about it. Glad that you told me about this. We will review the medication, then we will provide you a printed copy once you be discharged.
Thank you very much, doctor.
So I am here with you your laboratory result and physical examination results as well. So based from this, you have a pain localized at your right lower quadrant, okay? And nausea, vomiting, and anorexia were also noted. With that, you have experienced severe pain and it is persistent. With your consent, I would like you to seen by a surgeon for further evaluation and management. Is it that okay with you?
Sir, you have appendicitis that we need to perform appendectomy before your appendix ruptures. I would like to refer you to the cardiologist for cardiopulmonary clearance.
You have normal ECG and chest X-ray results, and no notable signs and symptoms of cardio or pulmonary insufficiencies. You are allowed to undergo the contemplated procedure.
Okay, thank you, Doc.